What's up, guys? Dr. Seth back to help you solve your powerlifter problems. So the whole idea that training is rehab is something that we hear said fairly often, but it's something that I see executed well pretty rarely, especially on social media, where we're seeing a lot of, fluffy rehab drills, a lot of stick the lacrosse ball here, where, or whatever. And not that I have a direct problem with either of those if they're used in the right context for the right reasons, but it's missing the boat of the training element because training involves progression. And when we're saying training is rehab or that rehab should be training, what we're really saying is that what we're doing for rehab should be progressible in challenge so we can increase the stimulus as we improve so we can then get a greater adaptation and then continue to drive ourselves forward and forward and forward and build and build and build and build. And that's what's missing most of the time in the social media rehab world is the whole idea of progression in what we are doing for our rehab. And if we are doing rehab, if we are trying to get something to feel better, an easy way to get something to feel better is to find something that kind of hurts but not that bad, start light enough that we can manage it, and then increase loading as we go as things improve so that we then can handle more. Excuse me. Today on Instagram, I posted a reel talking about the JM press for this purpose because when people deal with elbow pain, JMs are usually something that really, really sucks. They're something that no matter if it's tricep, no matter if it's inside the elbow, outside of the elbow, JMs tend to piss all those things off. So if we're dealing with elbow pain, because JMs tend to piss those off, they can be very, very, very valuable for rehab purpose if we start them light enough that they're not really pissing things off, and then we can go from there and we can progress. And by progressing what we can do with the JM, we're going to be increasing tissue tolerance at that elbow. We're going to be increasing sensory tolerance so we can handle more load without causing a pain response. We're going to be making everything involved in that elbow stronger so that it can handle more down the road. Now, as far as like those fluffy drills and stuff go, again, I'm not against those. I like to run some mobility drills. I like to look at flexibility. I like to look at range of motion. I like to look at positional access. The problem with a lot of stuff that we see on social media is that it isn't progressible. A lot of these drills, they're hard to increase loading on, they're hard to increase challenge, and therefore they are hard to progress, they're hard to train, and they're easy to spin your wheels on. And if we're starting with, like a fluffy drill for whatever, if we're starting with a bird dog for low back pain, we need to think like, okay, maybe the bird dog is difficult to directly progress other than just isometrically contracting harder at either end of it. What can we do that's similar to a bird dog that will drive us forward? And for that purpose, I like things like a single leg glute bridge. Again, we're getting hip extension on one side, we're having to brace across the torso, we're having to control our pelvis, and we're training that glute to do its job to transfer force from the pelvis up in the torso, right? And it's like once the bird dog is totally doable, once we seem like we're not getting better from the bird dogs, we progress to a single leg glute bridge. Once those single leg glute bridges are totally doable, we could even start sooner than when they're totally doable, but we can include a single leg RDL. Again, same thing, it's just a step up in challenge and movement quality. So it's like, if we're talking training as rehab, we could either be talking about things where we are using load as the primary driver, or we could be talking about things where we're starting with a relatively simple or easy access movement and then progressing in movement complexity and then adding load later on. So it's like, what it comes down to with training as rehab is that we need to be thinking, are we progressing in our rehab path? Are we increasing challenge so that we can then adapt more, so we can then handle more? Are we actually doing things that will get us better? And it's like, if we don't want to handle a heavy barbell, if we aren't athletes, if we aren't pushing our bodies, we don't need to do a ton to have a successful rehab. Like, the amount of stimulus required to get us back to going for a walk is very, very low compared to getting someone back to deadlifting 800 pounds, right? So the stuff that we see for Gen Pop Physio, it just often isn't enough to get someone where they need to be able to handle the barbell again. And that's where using training can be a very, very, very good tool, and understanding how training can be used can be a very, very good tool. And when we're jacked up, when we are in a place where we feel like we're in trouble, it doesn't need to be heavy to push us forward. It just needs to be heavy enough to do the trick. And a general recommendation for that is like, say your back hurts deadlifting once you get to 600 pounds, but at 400 pounds, it's just kind of uncomfortable. I'd suggest that someone hangs out at 400 pounds and just accumulates volume there and gets better and better and better while they work on simpler movements and increasing movement complexity outside of deadlifting, and then we're going to kind of mesh those things together and let what we're doing with a single leg glute bridge, let what we're doing with single leg RDL, progressing on those, progress up the deadlift, and then we're just kind of going to ride that wave up, working everything at the same time and looking to increase what we can handle. And it kind of got a little bit messy at the end, so I apologize for that, but that kind of sums up the gist of my philosophy on rehab and how we can use training to push us in the right direction. Hopefully that helped you guys. Drop a like if you made it this far. And I'm back to my more normal red color, screwed with light temp a little bit, so glad I am not purple anymore and people aren't worried that I'm going to immediately drop dead. Thank you for watching. Have a great rest of your day and don't be afraid of training.